I once treated a woman with heart failure who was hospitalized almost every month due to worsening symptoms. We repeatedly emphasized the importance of limiting her salt and fluid intake, but she'd go home and drink pickle juice instead. I'm not a doctor, but as a former Army medic, I remember a month-long training mission in the desert. A soldier came to me complaining of eye pain after leaving his daily contact lenses in for 3 entire weeks. Not a doctor here, but a classmate in my engineering program managed to give himself scurvy by eating nothing but chicken tenders every day. This story involves a lack of common sense rather than a surprising survival tale. I was working in a pain clinic evaluating a man in his 40s or 50s. After a full assessment, he mentioned that aside from his pain, his biggest issue was an inability to sleep because he was urinating over 20 times daily, with at least 10 trips to the bathroom during the night. Alarmed, I immediately thought of undiagnosed diabetes or other serious conditions. However, his labs were completely normal and there were no other symptoms. When I asked about his caffeine habits, he casually mentioned drinking 30 to 35 cups of tea a day. The worst part? He started this excessive habit simply because he'd heard that staying hydrated was important. Mystery solved. One of my favorite stories from my brother, who works as hospital security, involved a woman arriving with her emotional support miniature horse to visit a relative. She couldn't understand why they wouldn't let her and the horse into the patient's room. My brother had to escort her out. Well, she wasn't a patient. Her sheer lack of awareness was truly astonishing. A diabetic patient heard that honey could be beneficial for treating wounds, which is true. Unfortunately, he assumed pancake syrup would work just as well. He treated his poorly healing foot ulcers by carefully applying wet bandages coated in pancake syrup twice a day. Um, as a dentist, I have plenty of bizarre stories, but one that stands out happened a few weeks ago. A man in his 40s came in, puzzled as to why all his teeth were suddenly in constant pain. As we chatted, he casually mentioned that his acid reflux had been flaring up, though he didn't think it was a big issue. His version of a little reflux involved pacing around for hours at night because his stomach was so unsettled after late dinners. Eventually, I learned that he had started drinking 6 liters of sparkling water daily in an attempt to lose weight. Yes, 6 liters every single day. His digestive system had essentially turned into a bubbling cauldron of acid, and his teeth were dissolving as a result. I had to urge him to give his body a break and drink plain water instead. A man came into the ER complaining of abdominal pain. While taking his history, we learned a few things. He had just been released from prison a few days prior. He was staying at his mother's house, where mold was visibly growing on the walls and ceiling. While walking through the kitchen, he saw a cup of amber liquid on top of the fridge and drank it, only to realize it was Pine Sol. A CT scan revealed intussusception in his small intestine. While waiting for a surgical consult, I noticed blood on his sock. Upon removing it, I found a gunshot wound. When asked about it, he casually replied, "Oh yeah, I was twirling a gun and accidentally shot myself in the foot." While working at a urology clinic for a few months, I heard about a man in his late 30s to early 40s who came in with a painful inflamed rash on his scrotum and perineum. He had tried various creams, medications, and detergents, but nothing helped. During the exam, the doctor noticed a slight odor but didn't think much of it, as dealing with such smells was common. However, after the patient got off the table, the doctor noticed a skid mark on the exam paper. It turned out that the man wasn't properly wiping or cleaning himself, causing fecal matter to move forward as he walked, resulting in what was essentially chronic diaper rash. While working at a physical rehab hospital, I frequently overheard this conversation between doctors and newly admitted patients. "Doctor, do you know what caused your stroke?" Patient: "The hospital said it was high blood pressure, but I don't have that anymore. The medication fixed it, so I stopped taking it." "Doctor, didn't your primary doctor tell you to continue the medication?" Patient: "Yeah, but you know how doctors are. They get paid by drug companies to keep us on stuff we don't need." "Doctor, high blood pressure caused your stroke. You're lucky to be alive. You're going back on your medication now. If you stop taking it again, you will die. Here's the report showing your blood pressure when you were admitted." Patient: "Wow, that's really high. It was never that bad before." Doctor: "It got that bad because you stopped your medication abruptly. Don't do it again." Some patients would take this advice seriously and vow to stay on their meds, saying things like, "My spouse will kill me if I stop again." Others come back after another stroke, more debilitated than before, or we'd hear they had died after ignoring the warning. I once cared for a man who was so deeply religious that I had to wonder if it bordered on schizophrenia, though it turned out he was simply devout to an extreme degree. This man in his 60s had tried to replicate Jesus' 40-day fast. I'm not sure how far into it he managed to get, but by the time he was admitted to the hospital, he was so weak that he needed a feeding tube and could barely move his arms and legs. Eventually, I was able to discharge him to a physical rehab facility at the end of his hospital stay. As I left his room for the last time, I wished him good luck with his recovery. His response: "I don't believe in luck. I only trust in the blessings of the Lord." My reply: right,